You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, don't let your fear of the dentist keep you from having the smile you've always wanted. With us, we have Sacramento's dentist, Dr. Ludlow. Dr. Ludlow, welcome to the program.
Thank you. Thank you very much, Randy. I'm happy to be here.
Now, before we get into today's topic, and I know you brought some photos, so we'll get to as many of those as we can, but for people that don't know you, tell us a little bit about your practice, who's your typical patient, and what are the different procedures that you do?
Randy, we do it all. We're a general practice dental office, and the patients that we see, they come in for things as simple as fillings, crowns. We also have a tendency to see patients, teenagers that come in for fast braces and wisdom teeth removal. But we also have a huge part of our practice. They're more fearful of the dentist. So they may come in for an implant to replace a few teeth. They may come in for to have their full denture.
So people that are really like dental, like a phobia about going to the dentist.
That's exactly right. People that are really truly afraid, they come to us and we help take care of them. So they might come in and we give them 2, 4, 6 implants to support their denture, and they're very, very happy. And we also see patients that have sleep apnea. That didn't realize it. They'd come in, we get them sedated, they fall asleep, and they never knew ever that they had sleep apnea. And
you also, have and we're going to have you back on the show to talk about this specific topic, but people that were on the CPAP, is that right?
That's correct.
That are off.
That's right.
With, maybe an appliance therapy or something like that.
That's correct.
Interesting.
It just changes lives. It's incredible.
Okay. So you do all the standard stuff. You do orthodontics. What about
That's correct.
Like extractions, things like that?
Yes, we do wisdom teeth extractions. We do teeth that are broken down, and we take those teeth out and do bone grafts and implants, and we do the full spectrum of dentistry.
You really feel like you're changing people's lives.
That's the best part of what we do, is we really do change lives, and that's what really makes us happy at the end of the day.
I should mention this. We talked on the phone yesterday, and people need to know that we're talking about, by the way, don't let your fear of the dentist keep you from having the smile you've always wanted, and we're with Dr. Ludlow. But on the phone yesterday, and I loved what you said, because I said, well, let's talk about what your passion is. What you think is the most important. You said, I think I could help the people that are afraid of the dentist. If we get them in, those are the people we could transform their lives. So elaborate on that.
Well, I think a lot of times people feel like their dental problems are worse than they really are. And so, if they would come in right away, we could take care of things for less cost and really get them smiling right away and really changing their lives.
Is fear of the dentist really, is it a big thing? Because I obviously don't hear about it. I never hear people are afraid of the dentist.
The statistics show that 50% of the population don't go to the dentist at all. And I think that a big part of that has to do with fear. But what we find is that, maybe as a child, something occurred in their treatment of getting their dental work done that created this phobia, and it just kind of builds. And
so how do you get past that?
Well, that's a good question. All those processes really change your physiology. So a lot of times people think it's just in their head. It's just all mentally they have this fear. But what we've discovered, and science has proven this, that it's deeper than that. It's physiologically. And so what we do is we help retrain people to overcome that.
And you have people that were deathly afraid of the dentist?
We had patients.
And then now they're fine?
Yes. We had patients that you couldn't even put a mouth mirror inside their mouth to look at the teeth. They had to be sedated just to look at their teeth. And now they come in and they can get their teeth cleaned. Maybe they still use a little nitrous, and others have totally transitioned off of medication, and now they just come in on routine visits. Okay,
now we should talk a little bit about the sedation you offer.
Yes.
Because I guess you offer everything and have special training even in IV sedation.
Yes, we offer nitrous gas, which a lot of patients absolutely love. Matter of fact, you mentioned that you enjoy nitrous.
Yeah, I got a cleaning recently, first time that I've ever had nitrous, and I'm going, boy, this is fantastic. I was able to look at a TV on the ceiling. Do you have those, by the way?
Yeah, we do have TVs. We call that cartoon sedation for our kids.
Oh, you do?
Yeah, and that's wonderful.
It's like I've figured out the world's problems, you're in this nitrous, but then you come out of it right away, which is nice. So you could drive home or whatever.
Yeah, you can drive there, drive home, and patients really like that. The next level of sedation, we call it twilight sedation, and it's just a little pill that people take, and they come in and they kind of they fall asleep, and they're kind of a little in and out, and they just are very, very comfortable with their sedation.
Now, some dentists, look, I've interviewed some dentists.
Yeah.
I go, what are your thoughts on sedation? And they will tell me, I don't need sedation in my practice.
Yeah.
Or I don't need this. I can calm people. I have
Yeah.
a knack for it. And I felt like that might be insensitive.
I think it's completely.
What are your thoughts on that?
Yeah, I think you're absolutely right. It's
Really?
completely
Okay,
insensitive. Yeah, because matter of fact, I was talking to another dentist the other day. It's funny you brought that up, and he said I can talk anybody through any procedure, and they just don't get it. They don't understand that this is physiologic. You know, this whole problem they're dealing with is not in their mind, and unfortunately, patients, yeah, they're kind, they're nice, but they're dealing with real issues here.
But even for people that aren't even afraid of the dentist, like I'm not afraid of the
Yeah.
dentist. My son's not afraid of the dentist. But
Yeah.
boy, if you get that nitrous, it's very relaxing.
That's right.
Okay, so the next level up, you could give them a pill.
Yes.
Okay, and then now you have training in IV sedation.
Yeah.
Which not a lot of dentists have this.
Yeah, I'd say maybe less.
General dentists, what? What's the?
Maybe less than 2% of all general dentists have been
right?
trained in IV sedation.
Okay. You need a
And
special license for
You
that?
need a special license, specialized training, and yet we have specialized monitors. We monitor, all the vitals that to help make sure we know that patient's okay.
What about safety though with IV sedation?
Yeah, IV sedation is actually safer than all the other forms of sedation, because we can get somebody into sedation very, very quickly, and we can bring them out very, very quickly. And you don't have that lingering effect.
So it's different than anesthesia,
That's
like in
correct.
the hospital.
That's correct. With anesthesia, you don't have control over your breathing. With IV sedation, you have control over your breathing, and because of it, you're able to. It wears off a lot faster, so you feel more with it after.
All right, now what are the different categories then? Okay, so we're talking about phobic patients. Don't let your fear of the dentist. What are the different categories of patients that take advantage of your sedation program?
Well, we have a few different categories of patients that come in. One, we have patients like you were talking about. They come in and they're regular patients, but maybe they're stressed, they have high blood pressure, and we give them a little bit of nitrous, and it just makes them their experience better, and it's safer. Okay. The next level is patients that they really have this phobia that's going on, and they couldn't come in the dentist if you didn't offer any sort of any type of sedation.
Okay.
So these patients are ones that they're the ones we see the most dramatic effect from. They're the ones that really we see life-altering changes.
Like what? Like what?
Well, we have people that weren't smiling at all. Their perception of their friends of them is that they were angry, or they were always mad, or very, very serious. We give them the smile of their dreams, and all of a sudden they're able to smile. They were able to get that job. They were able to get that promotion, and now they're the life of the party. Whereas before they were that wallflower.
Do you see them change? I mean, you change their smile. You know, it's a bit of a cliche, and you change their life. But do you see changes?
We see amazing changes, and that's what really motivates us to do this, because these patients. They are wonderful people, but they are very, very scared of the dentist. We first meet them, we'll tell them, one day you'll get to a point where you can come in here and feel comfortable, and they laugh at us. They say, there's no way, Dr. Ludlow, I'll ever feel that way. And it's always rewarding when we get to the point where we're finishing things up, and they say, remember when you told me about this, that this would happen? And I said, yeah. And they would say, yeah, this is, I have a matter of fact, I have a story right here. Some patients here, I'll show it to you. This is a woman who came into us in a lot of pain. Okay. And matter of fact, when you see her after picture, you won't even think she's the same person.
Her after.
It's shocking.
That's got to be unusual, though.
To you it might be unusual, but to us, we see this all the time. People hide their smiles. They aren't quick to. If they have a smile like that, they're gonna hide it. They're embarrassed, and they don't. They're in pain, and you might perceive them as angry or mean or just grumpy, but the fact is that they're just hiding their smile.
Okay. So when she comes in, what are her goals? Just to get out of pain? Like you said, she's in pain?
She came in, she wanted to get out of pain, and she just wanted to be able to chew better. That was her whole goal. But we saw an opportunity here, and we presented her with some great options. And once again, when you see the after picture, she's not going to look like.
So she was afraid of the dentist. That was her problem.
Extremely afraid of the dentist. Yeah.
Okay.
So she was afraid of the dentist, and then because of that, she never saw the dentist because of all of her pain. So it builds on each other. So she came in, we looked at, and unfortunately, the number of options go down the longer you wait. So I encourage anybody who has challenges to call soon.
To get in early.
Yeah, because we have more and better options. So what we did for her was we removed the bad teeth and we replaced her teeth with a beautiful smile makeover, and that was supported by implants.
Okay, so let's take a look at the after. Oh my goodness, huge difference.
Huge difference.
Huge.
Yeah. So
you said it earlier. It doesn't look like the same person.
You know, it's amazing what happens when people can start smiling again. She regained her confidence. You know, she started working out a little bit more. There was some weight loss that occurred. She was able to overcome her pain, and you know, she got off the medications that gave her more energy.
Now, when they look at themselves in the mirror for the first time and see this, what happens?
You know, she was in tears. You know, she gave us a big hug, and that's where it's the most rewarding thing we ever do, is when we get to introduce them to their new smile and their new life, and it's incredible. And that's why I love being a dentist, right there. As you look at her smile, you notice her smile fills the corners of her mouth.
Okay.
You notice her teeth will follow her lower lip line. And you also notice that with her smile, it supports her facial structure. So we see that as we support the smile, it's like a facelift. It's really incredible.
Yeah, side by side, it really doesn't look like the same person.
You know, and you look at it, this is life changing. If she were to go to a job interview and she were able to smile, and versus before, maybe she doesn't smile, you really see who would they hire? Would they hire the person smiling or the one?
That's a good point, right? You hire with all things being equal, I guess the person that looks positive.
That's right.
Healthy, etc. Very nice. Did they ever come back and tell you, you know, I'm smiling more, or?
Well, you know, the amazing thing about this situation is that she really changed her life, and she found that she went back to school. She's now doing some job training programs.
You say they lose weight?
It's amazing. All of a sudden, they can eat properly. You know, the body is able to digest foods better, and they can eat healthier foods by having a healthy set of teeth.
Was this, now in her case, what kind of sedation, if you don't mind?
We use IV sedation in her case.
Now, is it true that with IV sedation, right, they don't even remember the procedure sometimes? Is that true?
You know,
that sounds like an exaggeration.
It does sound like an exaggeration, but that's the amazing part about it, is that there's a little retro amnesia involved there. So they just don't remember the experience, and they wake up and it's all done. And
like, what have they ever said to you?
They remember kind of coming in, and as we wheel them in and get them set up, and then they fall asleep.
Do they say it's done? Is it done yet?
Oh,
that's
yeah.
it?
Yeah, they still, yeah. That's the amazing thing. Here, after a few hours of dental treatment, we're working with them, and they wake up and have you started yet? And
really?
And we're all done. Yeah, it's shocking.
Do you get, now when a consult like this comes in, okay,
yeah.
And we're talking about don't let your fear of the dentist keep you from having the smile you've always wanted. We're talking to sedation dentist, Dr. Ludlow. But when you come in, do you see that end result? Do you get a bit excited?
Oh, I get really excited when I see patients like this, because one, I know that not only can we help their teeth, but we can just change their whole life. And
do you think, boy, this is going to be a good one? I mean, what goes on in your head?
Yeah, I really do. We talk to them, we get a good sense of where they're at, and we can tell really quickly whether they're going to be a good case or whether they're not.
Okay. Now, we're talking a lot about the anxious, high anxiety patients.
Yeah.
One of the things that on the phone that you mentioned, that the type A personality or the CEO or the busy person can get a lot of work done under sedation.
Yeah, I think our
elaborate on that.
Yeah, our business executives actually love this because they're so busy. You know, in our area we've got business executives flying overseas, and they're just, you know, our economy, they're just on the go constantly. And so they actually look forward to the sedation because this is the day they can justify as a day off. But they get everything done.
They say that to you.
They do. They say, you know, I look forward to it. I can relax this day. I wake up. I never get a better night's sleep than the night I do this, and this is great.
So you could do, you know, what would take maybe 3 visits to a dentist.
That's right.
All in one day.
That's correct.
Like 3 or 4 hours worth of work? Right there?
You know, Randy, to be honest, we've had some cases that have required even longer, where we've gone, you know, 12 hours at a time.
Is that right? And that's safe?
And it is.
Could anybody argue with what you're saying? They're saying that sedation, IV sedation is not safe?
No, no. So IV sedation is very, very safe, especially when it's done the proper way. There are some people that don't use the proper monitors, and they kind of cut corners, and that's where it cannot be a good situation.
Now help me understand this, because we had this discussion on the phone,
Yeah.
because I asked you about cost. It's less expensive for you because you're not bringing in somebody.
That's correct.
Is that right?
That's correct. It's also less expensive to do sedation dentistry, period, because the longer you wait to do dentistry, that cavity doesn't get any smaller. It only grows and gets bigger. And so the sooner we take care of things, the less expensive it will be.
Now men, do they tend to put things off even more? I mean, until we're actually in pain? 'Cause I don't want to go to the dentist.
Yeah, that's right.
You think of my teeth clean. Nobody
That's right.
wants to go, but you go and
Yeah,
you're
I think men might be a bigger culprit than women, but I'll tell you, once they find out that they can come in, get this thing taken care of, and have no memory of the experience and have virtually no pain after, they love it.
Okay, good.
Yeah.
Now tell me about your training, by the way, briefly, because you do people, I guess, very difficult, complex cases.
That's correct.
With these fearful patients. Let's talk about a little bit about your training briefly, and I want to see the other photos after dental school.
Yes. So I'm fortunate in the sense that I went to dental school at a great school, and then I came and practiced with my father right after, and he and a partner, they worked together for they both had 35.
So your dad was a dentist.
I grew up in dentistry. I'm guilty.
You were always a dentist in your head.
To be honest with you, I was questioning that just purely because my dad was a dentist. But I kept on coming back to it because my passion for dentistry is there.
Okay, good. Okay, so like you're always learning. I mean, you learn about dental implants. You do extractions.
That's correct. So my wife calls me a dental CE junkie because I'm constantly going to a continuing education. I'm sorry. And so I'm constantly going to classes and doing training on implants, sedation, sleep apnea treatments. Just always adding the latest, greatest
Is there really that
technology.
much to it?
There's a lot to it. Not everybody can do what we do, and it's really it's quite an art that.
Okay, good. What other photos? What are we looking at here?
This guy is a great guy, but he was very, very fearful of the dentist. He thought his case was a whole lot worse than what we thought, and when we saw him. When he came in, he wouldn't smile. He would see darkness on his teeth, and he'd see cavities. He was afraid that he was going to lose his teeth. Fortunately, he came in time.
Like how afraid?
So afraid so much that it was 20 years that he'd seen his last dental visit. So,
wow.
So that's a long time to stay away from the dentist. And I think what happens is that we believe that as the time increases, they feel like it's going to get worse and worse to the point that they're going to lose all of their teeth. Now, in his case, we didn't have to. There were a few teeth that he lost, that we were able to replace with dental implants. But we were able to restore his teeth with beautiful veneers, and all of a sudden, he doesn't stop smiling. And
Very
so
nice.
He told me, he's like, people at work tell me that I'm happier, I look younger.
He does look younger.
And he's a great guy. He always he tells jokes, but because he wasn't able to freely smile before. People, I think, took him. They thought he was a little more serious than he really was. So that's the interesting thing.
Did they say I should have done this years ago?
Yes.
When did you hear that?
Yeah, he said, I should have done this a lot. It was a lot easier than he thought it was going to be, and he should have done it years ago.
So in Sacramento, okay, I mean, it's a big place. You're in Folsom.
That's right.
Would you say there's hundreds, thousands of people that hate their smile, walking around looking like they're mad or angry?
That's correct.
When in fact they're hiding their smile, according to you?
I would say even more than that, Randy. I would
Really?
say tens of thousands.
And they're just afraid of the dentist.
They're just afraid, and they don't know
It's
where
not
to go.
the money?
You know what?
I mean, it can be, but
It could be.
But there's a lot of people that have the money.
That's right.
That do nothing. Is that true?
That is very true, and really they don't know where to go, and they don't know who can handle their situation. And the other thing, a lot of them are embarrassed. These are successful people.
Okay, good point.
And they're just embarrassed to go to anybody.
So you don't guilt trip them when they're there.
Absolutely
How come
not.
you didn't brush and floss?
That's right. There's no guilt trips. We understand that the past is the past, and we just move forward, and we give them options that they can move on and act on.
That's great. Okay, so time for a few more photos. What are we looking at?
Yeah.
Here?
So here's a situation of a gentleman that came in.
So he looks like he has no teeth
That's correct.
on the front.
So he does, and he actually has roots. They've just decayed down. They've gotten really short, and they're rather unsightly. With him, he comes in fearing the worst, and you'll love to see his after, Randy, because he doesn't look like the same person. He looks a lot younger.
Yeah.
But he came in one day. We took care of his teeth. He, put him to sleep with IV sedation. He wakes up. He looks at the smile, and he can't believe that's himself looking back at him at the mirror.
Yeah. I mean, he looks like a tough guy in the before, and afterwards he looks like. I'm looking at him. He looks like some successful musician or something. It's
right.
amazing how you associate.
That's right.
Things with other things. Very good.
Yeah, it really changed his personality. Before, he wouldn't smile at all. We had to force him to get the first picture. And what we find is, and this is really interesting, Randy, is when we ask patients to smile for us, when the before shot, their smile is very, very small. When we're done, their smile, you'll notice the smile is even wider on the after picture than it is at the other. It just people feel more comfortable smiling. It's more natural to smile.
All right.
And so it comes out.
So what else do you have? We are short on time here.
Here's a woman, Randy, who's really afraid of the dentist. She comes in, she had a few teeth that were wobbling on the bottom, and she was really fearful.
So that was a denture, you're saying, on top.
That's right.
Okay.
So what we ended up doing was we ended up giving her the smile that she always wanted. You can barely see her smile in the first picture, and once again, you see how her smile's fuller on the top, and she was really surprised.
So what is that now? I mean, on the after, what is that?
So she has a beautiful cosmetic denture on the upper, and on the bottom she has implants that are supporting her teeth down below. So now she can chew food. Before she wasn't able to chew at all. So she was really, really surprised. And she the next day I called her, or that night I called her and I said, "How are you feeling?" And she said, "I can't believe that I waited this long. I thought it was going to be so much pain, and I thought it was going to be such a big process, and it was so much better than I thought. And I should have done this years ago."
Okay, good.
Here's a patient also that would, she has a pretty good smile before, but what you don't see are the cavities. You don't see the teeth that are broken down that she's hiding in the back. And with sedation, it gave her the confidence and the trust that we could fix everything in just a short time frame. Matter of fact, she told me that if it wasn't for sedation, she would not have gone forward and done her smile.
Do you get a lot of referrals because of sedation?
We
do. They tell their friends?
We do. It's contagious. People notice that you're smiling more, and people pick up on that. And maybe they're now more apt to go out and be more social. They golf a little bit more. They're out playing cards. They're a little more social.
How important is the smile in your opinion? I mean, you're a dentist. My guess is you're going to think it's the most important thing.
I have to tell you, I'm pretty biased in this, but studies have shown that a smile is very, very important. The American Academy of Cosmetic Dentistry did a study, on a smile, and they'd said that they noticed that 96% of people, when they ask the question, "What attracts you to somebody else?" it's their smile that they mention first. But in addition to that, I have to tell you that we see patients that with their smile changing, their lives change. And so,
like what?
Like I had this one patient, a sedation patient. She came in. She wouldn't smile. She was very conscientious of her smile, and so with sedation, and she was also fearful as well. So we put her to sleep, took care of her dental work, and she retired early. She ended up feeling better about herself. She said that when she would go to a party before, she would be the one kind of behind the group. And now that she was able to smile comfortably, she was now the person greeting the other people in the group. And so she ended up retiring early. She and her husband travel around the country doing her dream job, and she lost weight. She looks like a totally different person. It's amazing.
So we're just about out of time.
Okay.
And I'm sure, driving over here, you were thinking probably, I want to make sure I get this message across. Is there anything that you haven't said that you wanted to say?
I appreciate you giving me that opportunity, because it's never too late, Randy. And I think that's the message I want to drive home, is that these patients, they can have their lives back. They don't have to be in pain. They don't have to be uncomfortable. We can give them their self-confidence back.
Good.
And that's what's the most amazing thing about this process.
I want to thank you so much for coming on the show. So if they want to make an appointment, they get to see you.
That's
Is
right.
that right?
That's right.
And you don't seem like a scary guy.
Well, I try not to be.
I mean, did you hear though, hey, no offense, doctor, but I can't stand the dentist?
We hear that all the time.
And a comeback for that when they say that?
They do. It's one of those things that we don't take it personally because we know where this fear is coming from, and we love to change lives, and we just invite everybody to give us a call if you're interested, and we can do a free consultation.
Do you look at it as a challenge where they say, hey, I don't like the dentist, where you know that you're going to change their mind about the whole thing?
Well, it's funny because I always will plant the thought, and I'll let them know. I say, in the future, you're going to come to a point where you're going to look back and say, I can finally come to the dentist without my heart racing. I can finally come into the dentist or pass by the dentist without my hands getting sweaty, and you'll feel confident about coming to the dentist again. And that's what's really powerful. Now, most people that are fearful don't believe me when I tell them this. And it's so rewarding to see that and see them finally eating the foods they want to eat again and smiling the way they used to smile when they were younger. And it's just really rewarding for us to see that.
Good. I want to thank you for coming to the show. Great info. And these photos are also on your website
yes.
as well? Okay, good. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Don't let your fear of the dentist keep you from having the smile you've always wanted. If you'd like to see this interview again, you can go to our website at wellnesshour.com and just put in Dr. Ludlow. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.